Welcome to the Gross 1 Upper Extremity Palpation video. This is Lab 1, Clavicle, Scapula, and Humerus. We will begin with the clavicle and its features. To begin, we have the sternal end of the clavicle, which is more medial and next to the sternum. Work your way across the body until you get to the broader, flatter end of the more lateral end of the clavicle, which is the acromial end of the clavicle. Also, we're going to have an infraclavicular fossa, which is below and more lateral, and a supraclavicular fossa, which is more medial and above the clavicle. One other thing we will do here is the coracoid process of the scapula. It is a deep feature that is going to be in the infraclavicular fossa. To begin, we have the sternal end of the clavicle, which is more medial and next to the sternum. Work your way laterally across the body of the clavicle till you end up with the lateral, more flatter acromial end of the clavicle. The above the clavicle, more medial, is going to be the supraclavicular fossa. And then below the clavicle, more lateral, is going to be the infraclavicular fossa. We have the coracoid process of the scapula, which is deep, which you're going to have to use digital pressure in order to get credit for this, is the coracoid process in the infraclavicular fossa. One way to test this is to have the patient stand in an anatomical position and move their arm back, straight back, and forward, and in that infraclavicular fossa, you will feel a bump come and go. Then you know you are on the coracoid process of the scapula. To begin this section, it is usually easier to begin with the clavicle that you have already done, the body of the clavicle. You come over and find your acromial end of the clavicle. When you drop down onto the tip of the shoulder, there's a little depression. That is going to be the location of the acromioclavicular joint. The tip of the shoulder broadens out and flattens to be the acromion process of the scapula. When you work your way back from the acromion process of the scapula, you will be working on the spine of the scapula. Palpate across the clavicle to the end, and when you drop off of the acromial end of the clavicle, the little depression is going to be the acromioclavicular joint. Continue to the tip of the shoulder. The broad flat area is going to be the acromion process of the scapula. From the acromion process, work your way back at an angle onto the spine of the scapula. We are going to continue with features of the scapula. From the acromion process of the scapula, you work back onto the spine, and then from the spine, that leads to the vertebral border of the scapula. At the top, we have the superior angle. At the bottom, we have the inferior angle of the scapula. To make these features more prominent, you have the patient bend their arm behind their back, and you can start at the acromion process of the scapula if you like. Work your way down the spine. That is going to lead to the prominent medial vertebral border of the scapula. At the bottom, you are going to have the point where the borders meet is going to be the inferior angle. And at the top is going to be located, work your way on the medial vertebral border, is going to be the superior angle of the scapula. Features of the humerus. We are going to be pointing out the medial epicondyle, which is quite prominent. On the opposite side is the lateral epicondyle, which is not as prominent. You work up from the epicondyles onto the supracondylar ridges. So up from the lateral epicondyle is going to be the lateral supracondylar ridge. Up from the medial epicondyle is going to be the medial supracondylar ridge. On the humerus then, you're going to have on the lateral aspect, you're going to have the lateral epicondyle. On the more medial aspect, should be more prominent, is going to be the medial epicondyle. And having the elbow bent will ensure that you are not too low onto the forearm for these epicondyles. Working up from the epicondyles on the medial aspect, you will be on then the medial supracondylar ridge. On the lateral aspect, from the lateral epicondyle, you will work up onto the lateral supracondylar ridge. And the rotating of the arm is up to you.